Oh, PYT, BBQ. I've got your check-in. Sorry, I had to reboot my network here. Hope you're copying me fine. And get ready to start the net here. Wait one. Well, this is AA4FL for the Medical Language Radio Council Digital Voice Net here. It starts at the top of the hour. Sorry for being a bit late. I had some technical issues and had my laptop set here in the office and network itself because it was slow. As in drag, I went ahead and did that in a minute. Like, this is AA4FL today operating from the slow internet speed of Hawthorne, Florida, 12 megabits per second. Struggling with what? Starlink's on the way, and who knows, maybe some other cell phone based internet as well. Maybe another drop one. I hope everyone's starting off with a nice Memorial Day weekend. Those here in the United States. Of course, Monday is a solemn day, remembering those that have given their lives in service to the country. But the festivities on the weekends in celebration of the long weekend are present, as we have here at my house, where I've been outside working on getting the pool open for the season. And with the net here, we're using the QuadNet array to transcode our signals. So make sure, little housekeeping, when you talk, you might want to wait till tailgate. Just everything a chance to sync because it's a complicated series of servers and repeaters. And then after you key up, wait a moment before you speak as well for the sake of the performance will be a lot better. Are there any stations here that have emergency traffic for the net? If so, priority traffic, make your call now to 884 SL. And then heard, are there any stations that are on limited time today or a mobile? Go ahead and make your call.
KD4 Eyes.
Okay, Jack, thank you very much. And I assume that means you're going to be in a short time today. Great seeing you at our board meeting. As soon as we get everybody checked in, we'll give you a chance to have the mic first. I did check in K3F ZT Steve. It was great spending time with you as well in live. I'm all QSOs. I've actually checked in as a regular check-in. At this time, let's go ahead and take regular check-ins. Go ahead.
November 3, Indian Mike.
Okay, fantastic, Keith. Another person we spent time with is Hilton checked into our board meeting from Brazil by Zoom. So everyone here is part of our active group of individuals. Thank you for all your participation. Any other check-ins? This is with Marco, the Medical Image Radio Council Digital Voice Net. You don't have to be a member to check in. It's a roundtable discussion. We'll get some discussion threads going of suggestions for the members. And for any of you that are not members and would like to check in, please, we encourage you to not only check in, but be also part of the roundtable. And if you don't want to be part of the roundtable, please check in so we know you're there. This is AA4FL waiting for a check-in.
And 9 November 9, Oscar Mike Lima.
November 9, Oscar Mike Lima. Let me slow my voice down here. There's a little too excitable. Looking forward to festivities today. Family time. We got lots of time for the net. The advantage of A diminished number of check-ins for the day is all the extra time we get to spend together having conversation. Are there any other check-ins for the Medical Aid Creative Council net members or otherwise? Please call AA4FL.
WA1EXA Martin Cape Cod.
Thank you, Mark. WA1EXA. And Mark, I hope you're not a basketball fan. Can't believe Boston lost last night. I watched the game 5 and saw them kill the Heat. I didn't think Miami had a chance. Hopefully game 7 down in Miami will be different. I grew up a Celtic fan, families from Boston, but of course being from Miami, the Heat didn't exist when I lived there, but they do now. We can talk sports during that if we like. Any other check-ins, make your call to AA4FL. All right, no other check-ins at this time, but we will allow for check-ins a little later in the session. And we do appreciate everyone being here and for all the participation lately. I've been looking at the photographs that I have from the meeting. We all had a wonderful time, and I am going to find a way to get your photographs in this issue of the Ether. I'm going to make it a membership appreciation edition and highlight not only what we've done over the last year, including this net, but also some of the planned activities leading up for the next year or two. Our new president is in El Paso, and our El Paso meeting will be the annual meeting next year. It looks like it's shaping up to be in April, the weekend after Easter, but that still could change. We'll get all that information consistently going in the ether. But certainly a lot to look forward to. See if we can stimulate some more interest in this net. We appreciate this group, which is the group that's here all the time when we let it drop one. AA4FL, being that this is Memorial Day weekend, and Memorial Day being Monday, I am fortunate to have not had any of the service members in my family pass away in service. We do have World War One, World War Two, and Korean vets in our family. I was that in between generation right after Vietnam that didn't have to even register. But appreciate everybody's service. And I guess my grandfather did eventually succumb to injuries from the war because he did have mustard gas exposure. He fought in the Ardennes in World War One. So I'd like to hear about your families and the service in your families. And I'm going to turn it over first to someone that's outside of the United States. If you want to BBQ for his comments. Well, actually, if you can wait just a second, Hilton, let's pick up Jack, JD4IZ, because he's on limited time. Go ahead, Jack.
Yeah, thank you, Jay. I just grabbed the one handheld I had charged up, which was the DMR handheld. I hadn't used it in a while. It seems to be working okay. Good. Yeah, I'm proud holder of a GD214. Coast Guard service from 1971 to 1975, active 75 to 77. And it's active reserve. And then they kicked me out because I went to dental school and they don't have a medical car. Anyway, that's a funny story. My dad is alive. He went to medical school during World War II and graduated just as the war was ending. He did serve during Korea in Japan as a doc in one of the medical centers, cleaning up the folks that the NASH unit sent over. Went on to have a great career as an infectious disease doc and eventually became chair and then a dean at Emory Medical School. He is alive, kicking, 99 years old, living in Chapel Hill, North Carolina. And if I recall correctly, he's a honorary member of Marco. He is not terribly active, but occasionally gets on. Mostly on HF when I've got my remote station running. Let me drop it. I do have a couple of comments. My comments have to do with the grand infectious disease experiment at Hamvention. And amongst the many groups that I belong to, I am getting reports of folks, a lot of folks, over 50, 60 at last count that I'm aware of, who have come down positive, some of whom are quite sick with COVID, who were exposed during Hamvention weekend. It seems many of them were in either the contesting university or the 4 days in May activity, or went to many of the forum. So being shut in with limited ventilation and all that seems to be one of the factors. But I also hear tell that some of the folks from Yesu and DX Engineering have also come down. So they were at many of those events. So there you go. Not a happy thing to have to report, but definitely of interest. I hate that that's turning into a super spreader event, but I can't say that I'm surprised. KD4 eyes.
KD4 IZ AA4FL. My gosh, Jack, thank you for making a report that's, I guess, has been anticipated, knowing what's happening with rates. Hopefully they'll be okay and their families will, but they've also exposed. We were fortunate, just about all of you were in Xenia, but our booth was at the end of an open area and the wind was constantly blowing through to the point that we were having to recover papers from the ground. And I only went to one forum and did very little otherwise, but I can see why our own members, many of them decided not to come this year. So probably a little premature. But Jack, so the question would be also from other perspective. So if there was a flu outbreak and people came to him, they would get sick from the flu. So are we to the point with COVID right now where the actual morbidity is going to come from this? I mean, at what point does it become an acceptable risk? I mean, are we still in the endemic phase? Or are we getting close to the endemic phase in your opinion? KD4 IZ, AA4FL.
That's a tough question to answer. It is behaving more endemic. I know personally of several older, more compromised individuals and individuals who were anti-maskers and anti-vaxxers who are quite sick. Not sure exactly about hospitalization status, but reports are not good. I think that's the problem. You can exercise free will any way you want to, but it's like not wearing a helmet when you ride a motorcycle. I don't think other people should be responsible for paying the freight if you do get injured. In this case, I don't think other people should be responsible for paying the freight for those individuals who choose alternative lifestyles. And I mean that very seriously. I can't I can't I can't come over to that mode that allows people totally free will in public health. It just doesn't make any sense. Anyway, Susie's still treating it like an epidemic that needs to be controlled, and she's also gearing up to deal with any cases of monkeypox. We do have a case here of a number of African countries, particularly West Africa, who have attachment to the Baltimore area, one way or the other, and so it's fully expected, and it's just a matter of time for that to have to be dealt with. So take a deep breath. Here we go again. Katie for Isaac.
Well, thank you for the explanation, Jack. I know that it's complicated, and from what I've read personally, history will be the judge of when it's not a pandemic and when it's an endemic, because they really don't know. Because it's the whole world, and even if it wasn't a problem in the United States, it still could be in other countries. So the monkeypox, we did have a doctor that came by who in the ID world, and he said he wasn't really focused that much personally on him on COVID right now because he worked at the government level. He was dealing with monkeypox. So we also did have an MD there at the meeting who was an anti-vaxxer. So we'll have to check with him and make sure he's okay. Before you go, Jack, I want to take a list here of those that might have questions for Jack. Go ahead and call 8845. I'll make a list if you'd like to continue this thread with Jack. Go ahead and make it.
K3FZT comment on Jack's statements, which were excellent, by the way.
Okay, so far we have Stephen for this thread. Is there anyone else that wanted to ask Jack a specific question before he runs? Since he's on limited time, go ahead and call 8845. We'll have you list. Go ahead and make your call. Okay, Steve, your comments for Jack. K3FZT, go ahead and take the mic.
AA4FL and the group, this is K3FZT. And Jack, I very much appreciate your commentary and very much respect your call for personal responsibility related to the costs posed on the society for the illness of those who, as you say, choose the ultimate lifestyle. I don't know whether or not your personal belief system includes and based on what you say, I think it's a reasonable inference that you were focusing on direct costs, the costs of care. I don't know if your personal belief system includes the indirect costs, the costs of others becoming ill, the costs of providing what's effectively an incubator for future variants, which may or may not result in still further mischief. The indirect costs of medical care foregone because it was not available given the resources directed to COVID care. So that would be my question. Do you think there are, call them social, call them indirect, costs that folks should be held accountable for? K3FZT.
Thank you for continuing the dialogue there, Stephen. Jack, would you like to comment? Oh, KD4, go ahead.
Costs that have a huge impact on the medical care system, whether it's directed to COVID or any other infectious disease problem that ultimately could be controlled better than we have done it. Unfortunately, this entire thing got wrapped up in politicization and misplaced understandings. That's the kind way to put it. Misplaced understandings of what was going on and what could be done. I'm aware of all of those costs. Of course, my wife is a pediatric infectious disease specialist. She's head of a division at her hospital and for the hospital system she works with. So it's constantly a reminder to us, because there are folks that don't get cared for. There are folks who are being cared for in the system who have cancer, have other immunodeficiency issues, so they're more likely to get severe consequences, and those, of course, wind up costing the system and stealing the ability to care for individuals who have other needs in the medical world. Yeah, I'm with you on that totally, Steve. And social responsibility, that gets further into my politics. I am a hybrid believer. And, I'm not going to go into what that means, but I believe in rational solutions to problems. I don't believe in irrational personal belief trumping everything else, and I'll leave it there. Jay, I'll turn it back to you. I really need to get going here. I got to finish fueling up the tractor and get some work done. I also need to go find some fuel. I got to refill a large diesel tank with some agricultural grade diesel. It's going to be $250 for 50 gallons, minimal, or not 250, 500, close to $500. It's going to be expensive. Katie, I said. Go ahead, Jay.
KD4, Isaac, thank you, Jack. Thank you for stopping by, and thank you for participating in the dialogue. I'm sure we'll continue on discussing parallel subjects after you depart here. Have a successful day with your home projects, your farm projects, and we'll catch you next week. Although I'm going to have to ask somebody to take the net for me next week. One of my graduates is getting married, so I can't miss that. Especially since he works for Disney. I can imagine what the wedding is going to be like in the Disney realm. 7-3 Jack. This is AA4FM, and I'm turning next to PY2BBQ Felson. Go ahead, Hilton.
Okay. A4FLJ, this is Papa Yankee 2, Bravo, Quebec, and Bravo, Marco DVNet group. Very, very good to be back with you this week. We had a nice virtual meeting during the ham fashion convention. Unfortunately, I couldn't be present. Perhaps next year. Let's see what happens next year, and perhaps I can be present in the convention and the Marco annual meeting. Well, very interesting discussion about the points that Jack pointed out, and the social responsibility regarding health costs, and how it can overcome the individual rights. That's what we have seen in the past 2 years. And The problem is that we need to have a perfect balance between these restrictions, measurements, and the economy results. So what we are seeing now is the effect of the lockdown in our economy, and it's been bad. We have inflation, we have the rise of the cost of most of the goods, especially fuel, and it was because of the war in Russia and Ukraine, it got much worse. So let me wait one. UI2BBQ back. And what we have seen regarding COVID 19 here in Brazil the last few days was an increase of the number of new cases, a dramatic increase of the number of new cases, but thanks God, very light infections, only high respiratory tract infections, sore throat, runny nose, and dry cough. And maximum, it takes about 5 days to the patient be healed. Quite a few people need to be in the hospital. Most people being treated at home like a regular flu or influenza. We don't see more morbidity than we see in influenza infection right now. So I don't think it is a reason for another lockdown. And regarding the monkeypox, well, it was described the first case in South America. It was in the neighbor country, Argentina. We haven't seen any in Brazil so far. Let's see what's going to happen with this new virus infection. So back to you, JA4FL, PY2BBQ.
Thank you for the report, Hilton. So, Hilton, glad to hear that the infections seem to be light in Brazil. I think previously you mentioned that you had about a 90% vaccination rate or an extremely high, and including boosters. Can you just remind us what the status was from a public health standpoint in vaccinations?
Yes, you're right. Most of the population is vaccinated so far with the 2 doses. About 90% of the population with 1 dose is more than 85% of the population with 2 doses. And elderly, well, let's say about 60 or so percent with the first booster, and most of the elderly population, 60 years old and up, with the second booster. And next week we start the second booster for those in working in healthcare, and those 50 years old and up will receive the second booster right now. So it seems that the vaccination had a good effect in providing a low a low gravity, no, not so severe infections with those reinfected with COVID. Not only a first infection, but most of the patients we see now are in their second course of COVID-19. Back to you, JA, for FLPY2BBQ.
QSL, Hilton. Thank you. Hilton, I know we talked about a lot about COVID, and of course the net here is in general on that for other subjects. Uh, Thank you for offering to come here to the United States. Our annual meeting next year is going to be in El Paso, although we will have a booth, of course, as I have mentioned. Question I have is, perhaps we should consider having a group trip to Brazil. If we can, get a hotel lined up and make it planned well in advance, and certainly give us a chance to see another country and stimulate a group of hens in Brazil for you to interact with us. Do you think that's something that we could consider for a few years from now? Over.
Oh, that would be very, very nice. That would be outstanding. Yes, it would be great to receive a Marco meeting here in Brazil. You can count on me to help you to organize that in 3 years from now. It would be great. You can count on me absolutely, JA4FL, UI2BBQ.
Well, thank you, Hilton. Take a look at your calendar for the latter half of 2023 and see what you think would be the best time. I'm sure our members would probably love to get a reprieve from the hot summer weather and head down to the other hemisphere. But if you would float some dates, just take a look and then send me an email if you can. If you can think about it over the next few days, I'll be able to float that in the ether and see if there's an interest. 2023, 2024, just have sort of a group trip, and certainly we'd line up amateur radio activities and tourist activities and encourage spouses to come. As we're coming out of the pandemic, hopefully into an endemic, it's time to start socializing. We had a wonderful time over in Sydney, by the way. This is AA4FL. I'm going to turn it back to you one more time, Nelson. BYCBBQ, go ahead.
Okay, JA4FL, BY2BBQ returning. Yeah, I'll think about it. And we have some very nice places we could go and do this meeting. I was thinking of Fernando de Noronha Island in the Atlantic, about 300 nautic miles from the northeast of the country. It's PY0 country, so it would be nice to make some kind of the expedition over there as well. So let's think about it. I'll think about the right timing and the best weather. And yes, let's think about it. Absolutely, JA4FL PY2BBQ.
Boy, Hilton, that's a wonderful idea for the DXers in our group to do PY0F, a nice DXCC entity. Boy, that's a nice offer. If you have the resources and ability to plan for that, what I like to do in a case like that is plan a meeting, 4 or 5 days with tourist things, and then kind of the expedition onto it. But let's discuss that. Take a look at the calendar. When's the best time of year to go to the island there, and maybe for a contest weekend would be even better. Operate our group as a contest there. Wonderful thought and suggestion, and we have some other Brazilian friends that I'm sure would like to participate. And again, we need to offer opportunities for our members to enjoy and bring involved their spouses. That's one thing I find missing in amateur radio. Is, we go to all these meetings, we can, and the spouses will go, but when it's something special, it's vacation style, it really gives it more of a family feel. So thank you for that offer. We'll talk more at Hilton. Next on the list is Steve, K3FJT. Go ahead, Steve.
AA4FL and the group. This is K3FCT. I don't have a whole lot. I did enjoy putting a face with names and voices, and was grateful to be invited to join a group of longtime friends as the new interloper, and not made to feel like such in any way whatsoever. Um, Hamvention itself uh, is, I see, a really special sort of event, the gathering of a tribe. Wait one. Over 20,000 people, 20,000 hams there, according to Gordon West last night on the Wind System Technical Net. And I can believe it, my estimate was a little closer to 25,000, which is down from 2019 when apparently they had 33,000. But when all is said and done, I'm not sure the 9-hour plus minus journey each way is worth it for me to contemplate doing it again. And the flea market, while huge and bounteous in all sorts of ways, was really more than I could take in or wanted to take in. So seeing all the vendors was cool. That aspect of it is impossible to replicate elsewhere, I suppose. Though maybe Hamcation in Florida comes close. That's about it. I'm going to wish everybody the very best of 73's health and happiness, and be clear here, but I'll be sitting on the side listening for the most part. This is Steve in Philadelphia, Pennsylvania, K3FZT. I am clear.
Steve, it was an absolute pleasure. This is AA Florida, Hawthorne, Florida. It was an absolute pleasure to have you along with us. I enjoyed myself so much, and you were part of the reason why I enjoyed myself. And the group was very interactive, and everybody there seemed to hit it off. So that's the beauty of the organization, is meeting, having those eyeball QSOs and cementing that personal relationship. So even though not everyone attends convention on a regular basis, and our meeting is actually only their annual meeting every other year, it only takes one time to establish long-term friendships. And this interaction of medicine and friendships and careers and hobbies and the dynamic nature of it, and the fact that we have so many common interests, you and I, and some of the others. Of course, we're all here on the digital net, and that's one of your great loves, is digital radio. So your expertise is appreciated for the extended group. I will make sure to post this recording in the ether. Thank you, Hilton, for doing it. And that way our members can benefit from the discussion here. And Steve will throw some photographs in the ether of you, and we'll get to know you as well. Let me let it drop one. And do appreciate that Hilton is recording this today. Thank you for on our NetLogger window, posting on the instant message window, the YouTube live stream URL. So we're very version into the ether so that we have some of these reports. Out of curiosity, Steve, before I let you take curiosity, a question on Jack's comment before I was at. You had mentioned you think between 20 and 24,000 attended the convention down from about 33,000. I assume part of that reduction was for the very reasons we've been talking about. But in terms of what Jack had mentioned, had you heard anything indirectly about individuals that attended the convention getting coming down with disease from COVID infection? Or
For the group. So, two things. Thursday evening, there is a Mid-Atlantic DMR net run out of a Maryland club that typically gets 30 plus check-ins. And one of the net founders and regular net control ops reported that it was effectively a super spreader event with perhaps as many as 500 infections. So an order of magnitude larger than Jack is reporting. And that there was a CW event that seemed to be the nidus of the spread. However, wait I spent a good hour yesterday drilling down on the internet, looking at Ohio reported data, seeing what I could about Greene County, Ohio public health reporting, and broader COVID and Hamvention, COVID and CW, COVID and Contest University. And I was unable to find anything on the web to corroborate the assertions from the night before. So I'm just leaving it at that. Trying to be a bit of a scientist, I'm looking for evidence. Very motivated not to pass along concept. K3F said,
KA4SL, net control for the Medical Amateur Radio Council DVNet. Before we proceed with our discussion, let me pause here. Are there any stations that have not checked in already that would like to check in? If so, go ahead and make your call. Okay, no other calls. You know, it's interesting to ponder, you know, the effect of psychological nervousness. There's lots of reasons why somebody may not come to the convention. They may be taking care of family, maybe their age group, they may feel more susceptible because of medical conditions. But on the other hand, if we compare this to the flu, as there was some other infective process going around, I'm not sure how we compare apples to oranges here, and at what point the risks are not something to just consider, but not to affect our behavior in avoidance. You know, take normal precautions. Now, personally, I have been vaccinated with second booster, 4 weeks before because I went to Europe and I timed it 2 weeks before Europe, so maybe 5 weeks before. and I felt very comfortable. I did wear a mask a good deal of the time, not everywhere. And there were a number of people masked. But interesting to mention before we go on with our discussion, Keith will be next. I did pop into only one forum. In the forum, I did pop, well, actually, one forum in a minute, so a couple of minutes of another. They had a have mentioned who was a member of Mark, or honorary member. We had given him the membership. Aero, a flight surgeon, I guess, aerospace medicine, and retired. And he and Scott Wright were another physician who's at Mayo. Were giving a lecture about COVID. So there was quite a ton of crowd in that. There were people that were receptive to your comments, and there were quite a few masks in that particular forum. So kind of a mixed report here, and it will be interesting to see over time what effect this has. I would hope it would diminish in all ways over time, but again, history will be the judge of COVID's outcome or progression. Keith, M3IM, go ahead and take the mic.
A4FL in the group. A3IM. Dayton Hamvention was really quite busy at our booth, much more so than some prior years. We had a number of members stop by. We also had a number of past members stop by and talking about possibly renewing their membership. Break one. Hamvention has announced the official attendance at 31,367. So that's their official attendance by DARA. As far as the COVID things are concerned, the only thing I could find was an anecdote, and there was no data or anything like that. I have not been able to find anything that Dayton Hamvention was a super spreader event. But that's to be seen yet. There may be further announcements down the road. But as far as I can tell, that's not been a problem. And the other question becomes one of, did people get, if they are positive for COVID, did they get it while traveling? Or did they get it at Hamvention? Break one. There was a fair amount of social distancing taking place there, as well as meeting people and talking with them. So I'm not sure about that part of it. There's a lot of interesting exhibits by vendors. Interesting enough, ICOM is showing something that is still in the developmental stages and isn't even ready for public issuance in the near future even. And that was the 5 gigahertz radio concept that they're playing with. It was more of a teaser than this is coming out soon. They also had another amplifier that they say will be out in 12 to 18 months that was under glass at the display. I did get to talk to John Crook from Yaesu, and I did get to talk to the people from Ham Radio Deluxe, as they helped me tremendously with my problem with FTDX 3000, and I wanted to make sure I eyeballed them and gave them kudos for their help. This is M3IM, back to A4FL in the group.
Keith, thank you very much for getting us onto the Hamvention radio aspects. And I do appreciate that. And I was in the booth quite a bit, didn't get really much of a chance. I did sneak away now and then. For those who didn't know, Keith and I primarily did the booth this year. and we would let each other go for, short periods of time. We were there together most of the time, and we do something that Keith has been doing for years, and I have been helping out in recent years, ever since I've been an officer. And it's a lot of fun. Plus, he's my roommate. So, and I learned something new about Keith in this trip. I am not going to tell you the story of Keithless Ring if you don't already know it, because you want to pay attention. You have to wait for the ether, because there's going to be some pictures of Keith in one of his fingers, and what's on that finger, and the story that goes with it, Keith. So, you will be in the ether. So, thank you very much for your friendship and for the support of the digital night, as well as everything else you have done and do for Marco being a past president and a board member. Thank you. And now I know what I'm about. Howard, go ahead.
Good morning, Jay, and everybody on the net. Hope everybody's doing well. Glad to hear you guys enjoyed your time at Amvention. I apologize for somehow managing to miss both the book club meeting and the annual meeting online. As far as COVID in the Chicago metropolitan area, 15 counties in Illinois in total have moved to high community transmission rates, and that includes the entire Chicago metropolitan area. Mask usage is being encouraged, as are all the other protective measures. Even though we've crossed the threshold, the public health authorities and associated politicians have elected not to impose any mandates. I don't know that I have a strong opinion on that one way or the other. Our household, all three of us have cancer, so we've been very conservative in celebrating the end of COVID, and have not really been going out to eat or going out socially, and we always mask. And that's at least our personal decision. And with this current surge, it appears to have been a reasonable decision for us to have made personally. The news reporting is saying this is the largest rate of transmission we've had since the last serious wave. Franklin?
Okay, Howard seemed to have dropped after his break. Let's let him continue, and we'll check with him in a minute if he's still silent. Let him know if he's still key. I know, Howard, if you're copying us now, we lost you after you said you were going to take a break. We didn't hear the second half of your conversation. Go ahead. Okay. Still nothing heard from Howard. Let's take a break and move on. Mark, WA1EXA, how are you doing today, Mark?
Hey, WA1EXA, Mark Cape Cod. Let me just make sure. Do you hear me?
Just on Mark. Loud and clear.
Okay, and just want to make sure we get through. Well, as far as COVID goes, we're running very high numbers, back to what they had been during the height of the pandemic, but it's pretty much considered as an endemic here. Our hospital rate is unremarkable. Our death rate is not anything to, I mean, death rate is bad, but it's not spiked or anything. So everybody kind of taking a breather and going about their business. Some people are masking, some people are not. Great one. As far as what we're expecting, now we're getting into the busy season up here. Traffic is getting bad, and the rates of occupancy in the hotels and motels are high. Our biggest problem is we don't have enough people to work. So many of the restaurants are at half capacity. They're not opening all their tables. Some of the hotels have only half the occupancy rate because they just can't get enough people to work. People such as landscapers and the plumbers and any of the technical people are just not available. And since the pandemic has hit, things have really changed up there. Housing prices have spiked, and of course, everything is much more expensive, including the gasoline. A break one. There is some really consideration regarding the statistics. Everybody is pretty much not believing them because, as we're seeing, more people at home testing and reporting. The only reports we get are people who do end up in the hospital, which I said is low. So our expectation is that the numbers are far higher than what's being reported with health. Um, so that's on the monkeypox. We had one person in Boston who has been released from the hospital. He was at Mass General. As far as I know, that's the only report we had up here. And so that's about it. The weather is pretty gray and cool right now. Maybe it'll get warmer later, but we've been getting a few days of rain, and it still is overcast, and it's not raining, but looks like it's going to start any minute. So, if anyone has any questions, I'll gladly answer them. And back to you. You're waiting the answer.
Well, thank you for the report, Mark. Question for you, aside from amateur radio and COVID here, are you a Boston Celtic fan?
J. Todd, I have to say yes, or else I'll get my house all hit with eggs. But really, I'm from the western part of Connecticut, and my true beliefs or my true loyalty is with the New York teams. So I know that everybody's in mourning up here, but it doesn't really affect me that much. Go ahead.
Mark USL. I'm sure all your neighbors will be watching that Game 7 coming up. It's always exciting to see a Game 7. When we were on the trip, Keith and I had the sports. We flipped on a hockey game, and the Tampa Bay Lightning were tied with the Florida Panthers. I think we turned it on, Keith, for about a minute to go. And then Tampa got the puck like 9 seconds left, and on the Florida end, and with 0.9 seconds left, at least that's what the clock showed at the time, scored a goal to win the game. And they subsequently went on to win the next game and win the series. So, sweep the series. The sports can be a nice break from the realities of life. So can have radio. And so can both. So, everybody enjoy your holiday weekend. And for those of you I want to watch an exciting basketball game during 7 of the Celtic and Heat series. Is there any further traffic? This is AA4FL. Any other discussion before we bring the net to a close? So go ahead and make your call to AA4FL.
And I don't know, did you guys receive any of my transmission? I sent it into chunks, but I'm not sure you got either one.
Oh, Howard, sorry for not coming back to you. We got the first half, and then after you said break, we did it. We tried to let you know. So that second transmission might have been a little lengthy. Before we bring the next request, go ahead and finish your comments out. And you told us so much in the first part about Chicago's rates being out in one of the areas in Illinois it was. Go ahead and finish your comments there, Howard. Yeah, floor.
Sorry about that. I'm not sure why I didn't get through. My other one was basically a question on the emergency mind book. I did miss the book club meeting. I haven't read the whole book, and I was curious what your thoughts were. Is it worth the time to continue to read it, and how did all that go? That was the gist of it all. And I will now back to net control.
AA4FL. Yeah, my personal perspective on that book is it was interesting, but it wasn't anything earth-shattering. There was so much, a lot of common sense when he talked about the way that you train your mind for emergencies. And most of us in medicine or in the hospital field, industry included, already have those good habits. I'm sure there's practitioners that would benefit from it. But in terms of it being the most useful book, it was interesting. Certainly, if you want to read it out, that might not be a bad idea, or at least skim it. We're going to go away from medicine on our next book. And as you might have seen on the list here, I distributed. I want to talk about radio. I guess the science and history of the radio waves. So that one should be on the list here. Anything else, Howard? And I know I'm out.
No, sir, nothing new. I found that the emergency book, it just wasn't engaging me, but I'll eventually push through it. Thank you for your comments. And that's about it. I have one other thought. I can't remember what it is right this second. I'm sure it wasn't anything too important. I hope everyone enjoys the holiday weekend. And Monday, let's remember what it's actually all about. Tommy 3DL, and sorry about the broken transmission. And I don't know.
Yes, thank you, Howard. And on Monday, we all should remember those who made the ultimate sacrifice for our country. And too many young people that gave their lives for the betterment of our society and our country. Are there any other comments from the group before we close the net? This is AA4, I'll get you.
N3IM.
N3IM, go ahead, Chief.
AA4FL in the group N3IM. Yeah, I just wanted to comment about our next door neighbor, Dan Benson, being a physician who apparently has left the profession due to HMOs and developed an antenna called the compact antenna. And I thought Jay would mention it, but I don't think he did. But it was a very interesting time with him there and his antennas. This is N3IM.
Comment K3FZT.
Okay, thank you, Keith. I'm going to put it in the ether. That's why I didn't comment on it. I'm going to put a little article about him. gave him a membership personally. I'm treating him to a membership this year, so he'll be part of the group. Quite a nice and interesting guy. K3FCT, go ahead, Steve.
I use a compact 10 up on my Honda CRV here in Philly. 2 meter 440 compact 10 up on the roof rack of my Honda CRV. It's great out to about 20, 25 miles from the repeater. So for running around town, it's just wonderful to have that short antenna. Performs very well for me. K3 have said.
Hey, Steve, I think you have the regular version, not the plus version. I think one's 7 inches, the other is 9 inches. Elaborate, please.
Yeah, I have the basic version. Goes on an NMO mount. It's about what 10 inches long, give or take. I did not get into any of the other versions. Did chat with the guy at the group. Didn't know of the connection to Marco. K3 said.
Well, thank you, Steve. And of course, Jack is a physician. I believe he went to school at the University of Akron, and he did his internship as family medicine in one of the Cleveland clinics. So he was pushing to Marco, and I was planning on buying one, but kind of for a different reason. Performance is important, obviously, but for me, it's just different looking. It doesn't look like a radio antenna, which means it will be life approved. Does anybody else have that problem in their family? This is AA4FL. Okay, no one does. I guess I'm the Lone Ranger, and hopefully Randy will find that to be an acceptable option. Thank you for the report, Steve. With no other comments, I'm going to call the net to a close. Enjoy the holiday weekend. Thank you for stopping in with us on a holiday weekend. And WA1USA Mark, are you available next Saturday to take net control over?
WA1USA. Unfortunately, my grandson is graduating from high school, and I will be in Connecticut for the weekend. So I can't. I wish I could, but I can't. I hope you can get somebody else. Go ahead.
Yeah, well, Andrew's not here today. Keith at 3 a.m. Are you available? Would you be willing to do net control next week? Go ahead, Keith.
I don't believe I'm going to be available next weekend. I think we're planning a trip to Baltimore.
QSO Keith, that's grandchildren's on too. Have a wonderful trip. I'll get a hold of Andy and ask him. Thank you, Mark. As I said, I've got a former student, a PhD student, electrical engineering student who is now works for Disney. Wonderful guy, and I want to be there for Andy. And Andy has been very active with the college radio initiative. He and his brother have been there for the formation. So it's nice when one of your own becomes a leader in Amos Radio at the ARRL level. Sounds great, guys. I'll follow up and getting that control. I'll see you in 2 weeks, and I'm sure you'll have an engaging conversation with the net control next week. Safe travels and a nice holiday weekend. AA4 help bring in the Marco non-glamorous radio cancel TV net to a close and returning the frequency to the Quadnet array and its users. And thank you very much for the transcoding capability of the Quadnet. Once again, always there to support us, and we're very appreciative. AA4F out there.